I'm Dr. Becky Lynn. I am coming to you from Evora Women's Health. We are a concierge gynecology practice, and we specialize in menopause and women's sexual health. We are joined today by Christine, the founder of Rosebud, and we're really excited to talk to you about vaginal health and some changes that happen to women as they age and how they can treat them. So I think, Christine, do you want to say a few words about Rosebud and just tell us a little bit about your company?
Sure. Rosebud Woman is an intimate skincare line. And I like to say intimate versus sexual, but we'll get into that in a minute. We do all kinds of products that are meant to meet the needs of women as their skin changes for hormonal reasons and age reasons and whatever else. But more importantly, to really get you back in touch with this part of your body as for you, that it exists as a form of self-knowing, self-care, self-love that's been kind of repressed and denied over the years. And yeah, we're based in LA and sell all over the country now, thanks to people like you who believed in the vision there. So yeah.
Welcome to Intimacy Unmuted, the podcast that discusses intimacy, women's health, midlife, and menopause unapologetically.
So I'll just give our listeners a little bit of background on how the vagina changes as women age. So the vagina, when there's estrogen around, before your periods stop in your premenopausal years, the tissue is thick and it's moist and it has the cells that make lubrication. It's stretchy. It's got good elasticity, so it has collagen and elastin. And as women age, their ovaries start to make less estrogen. And then when their periods stop, their ovaries really aren't making any estrogen. They still have a little bit of estrogen around that comes from fat cells, but there's some big changes to the vaginal tissue. The tissue gets very thin and dry. It doesn't lubricate itself as well. There's not as much blood flowing to the vagina, and it doesn't stretch. So it loses the elasticity, the collagen and elastin. And a lot of women will feel awful, both just, some women have it so much dryness that even when they walk or if they sit on a spin bike, they'll feel uncomfortable. And other women just have difficulty during sex, that sex becomes painful or dry. And then whenever there's a small sexual problem, it can really turn into a much bigger problem. And a lot of women aren't aware of these changes, which is, one of my goals and my mission is to make sure that women have all the information that they need about their own bodies and what changes are happening or going to happen so they can do what they need to do to take care of themselves. So I wanted to ask you a little bit about your products here at Evora. We use a lot of Rosebud products. I came across them at an Ishwish conference. And for those of you who don't know, Ishwish is the International Society for the Study of Women's Sexual Health. It's a great resource. So if you want more information on women's sexual health, it's very scientifically based. It's not a marketing ploy. It's great information. I came across the Rosebud products. We got some samples and we really have heard wonderful things from our patients about them. So do you want to tell us a little bit about your products?
Yeah, sure. First, I'll just say Ishwish is wonderful. And we go there. We went in the first time just to continue our own education. There were so many liberating ideas that were shared there. It wasn't just about menopause or female sexual dysfunction or all kinds of other things, but it was also lifestyle things. Like we learned there, for example, that one of the top 2 reasons women have difficulty enjoying sex is body shame and that they can't relax. It's not even the mechanisms of it. And I was also fascinated to learn that the stuff that you're talking about women aging and natural processes and how the vagina changes during that also happens to younger women from stress, from antidepressants, from various kinds of, so that no matter what your age is, if you're having issues down there, you can,
that's a good point. Yeah. Oral contraceptives can lead to vaginal dryness. And I think many women don't know that.
That and permanent changes if you have a cancer if you go through cancer treatment.
Yeah.
And also like I was telling you that I just finished another week of this collective trauma training, and there's also so much like trauma and stress that's stored in there that also kind of has the mind body connection there. So the first product, well, I'll tell you, I wanted to start this line a decade ago, and the timing was wrong. So I was making products in my house, learning how to mix plants and herbs, and learning how to make. People would come in and there'd be like a giant quart jar of what looked like yogurt, and I'm like, no, that's not yogurt. That's Pussyceuticals. Wait. So
don't eat it.
I was doing a lot of research with Ayurvedic medicine and women's traditions around the world, traditional apothecary, Chinese medicine, all kinds of things to look at sort of what herbs. This is not something that just arose in human history. It just seems to have gone a little bit underground, but women must have known what to do in prior eras. So I began with that. And then I went out before I spent my retirement money on starting another company and did research. I asked 3,000 women between 25 and 75 what their top concerns were. And across the board, they reported the same things, just like you're talking about. Dryness was number one. Also, lack of sensation or arousal was one. Irritation, redness, intermittent itching, bikini zone troubles, those kinds of things, which we just lumped under the category of irritation. And then freshness, and not freshness in the sense of you have a bad smell or anything like that, but freshness like keeping bacteria out of the vaginome. So I said, okay, this looks like we have a good cross section of what people's needs are. Let's formulate one for each of these top concerns and do it in the most pure way possible. So plant-based, herbs that have studies against it, NIH studies or other global studies against it that show that they're effective, and then let's wrap them up in packaging and narrative that allows you to leave it on your night table, so that it doesn't have to be like tucked away, like, oh, Magnum, lightning bolts, purple, silver, whatever it happens to be. Like it's to shift the message that your sexual parts are for sex only, to this, like you live with them 365 days a year, 24/7. And also that there's like a way of knowing and being intimate with yourself that precedes being intimate with someone else. So the whole story unfolded from there. So I went to an actual chemist, a beautiful organic chemist in LA, and we worked on the formulas. And he the first time that I met him, he said, your recipes look like recipes. They look like cookie recipes. So we're going to start over. And he took a lot of the herbal knowledge, but then we compounded them in such a gorgeous way that the balm, for example, the moisturizer, if you scoop it out of the jar, it's like a thick unguent. And then as it heats up, it dissolves into a dry oil. So it has malleability on the skin. And I say, do it at night with a little massage, do hip points, outer labia, inner labia, and then leave it on overnight to do its magic. Then use it as sort of a daily treatment. And that really, that's the lead product. I could tell you about the others, but I'm kind of running on. So I want to make sure that it's on point. Yeah.
And I would say that's the honor that you're talking about, that one. Yeah, that is, I would say, the most popular with my patients. And we see, like you mentioned, like your study showed that that's what women are dealing with. And I think they like having something all natural that really addresses the dryness. So, we're big fans of honor.
Yeah, I mean, there are other things like dryness, people don't get the correlation, but just like you have if something's dry and you abrade it, it gets torn more easily. That's the other thing, is the correlation between dryness and UTIs in menopause. That was another thing we discovered, that if you're keeping that area moisturized, you're less likely to tear, so UTIs go down. And then the arousal serum was an interesting one. I have a farm on the Big Island of Hawaii where we were growing tons of beautiful plants and herbs. And a Polynesian plant called buzzbutton or spilanthes is one of the plants that were there. And it's used in Polynesia for oral hygiene and sexual arousal in women. Because it's a vasodilator, and all of the moisture is stored subcutaneously in the whole vulva vaginal region. And so it's non-keratinized skin. So the blood flow comes up from underneath and pushes the moisture out, and it mixes with glandular secretions. So you want to do all kinds of things to bring blood flow to this area, like massage it, do squats at lunch, do your hip wiggles. But then also, like, you can use topicals. So the arousal serum has 3 mechanisms. The first is a tingling and plumping sensation. And the second is this spilanthes, which if you were to get it on your tongue, you could get a mimic. You might have it there. You put the drop there, and then you'll notice that you start to salivate, because the rush of blood flow and moisture is making the whole mouth kind of foam and tingle like champagne bubbles. That's what's happening in the vulva and the vaginal canal. So that's the second mechanism. The third one is putting adaptogens in, because this part of the body is so much more absorbent than the rest of the body. You can deliver good herbals through the tissue there. So that's the Arouse serum. And that's more popular with younger women too. And I use it also here, just that's not Botox, that's actually Arouse.
I have tried it on my lips, and it does make your lips kind of tingly. But one of the changes that we see in menopause and as your estrogen goes down is that blood flow to the vagina and the vulva goes down. There's just much less blood flowing to it. So a vasodilator can really help improve that blood flow. So
yeah, and I would not skip the mechanics. I mean, this isn't product related, but like people do massage or acupressure. I have a little book. I don't know if you guys have it, but we did a book that shows the pelvic basin and where the pressure points are for massage in the pelvic basin. And if you press there and like around the femoral artery or the inguinal, like right in the inner part of the groin or right at the top of the pubic bone, there's a bunch of muscular attachments, and you can get some physical movement in there. And I wasn't joking. Like, we sit so much, and that sedentary nature does block off blood flow. So whether you're exercising or you're just standing up and doing hip circles, like as much mechanical movement as possible is great. Plus you can kind of get back into that like sensual groove, find whatever. Lately I've been listening to Silk Sonic, that Grammy award winning they like their first song out this year on the Grammys, and it's like I'm gonna leave the door open. It's this guy who's like standing at home. He's feeling his sexy, and he's just like calling girls. I'm going to leave the door open for you. And you put that on, and it's like very white, and you're in the 70s again and whatever. So anyway, yes, get your sexy on, and then use the Arouse and enjoy yourself.
I love that. And I think that's really important for women to know, that it's completely okay to do that. I feel like we have a lot of shame around sexuality, especially in the older age groups, just because of how society's changed. And I love that, you can get your sexy on by yourself, a little massage, and really get the blood flowing. And then we also, you can include a toy in that. You can use a vibrator to help improve blood flow as well. So, we recommend that some of our patients whose blood flow has gone down due to whatever, it's menopause, a lot of our, some of our cervical cancer patients have had vaginal radiation, and we really want to improve blood flow. So, arousal would be a good product for them. A little massage, a little music, and self-care, and maybe a vibrator or two.
Yeah, let's pause on the shame thing for a minute, because yes, I mean, I love all of those things, the same stuff that like brings your nervous system down. Touch, petting things, warm baths, anything that gives you that little oxytocin rush. You have most likely some element of skin hunger, unless you're getting touched every day and caressed by somebody every day. And so anything to enhance that. But the sexual shame thing is super real. In last week's podcast, I did the narratives that women have carried for many centuries. And so sexually controlling your body and protecting your sexuality is a really intelligent adaptation for many centuries, where if you got pregnant by the wrong person, you could be stoned or killed or something like that, and that you were really had to protect your sexuality and gated. And it wasn't for you. It was a sort of object of the patriarchy. And now you're coming into it. And by the way, if you grew up in a religious environment, like I just interviewed a woman who is conservative Mormon, and she has created a whole thing for women who are infertile, but who are in these religious traditions where being not fertile is considered your cross to bear, called Chasing Creation. Beautiful, beautiful work on infertility and loving your life anyway. Anyway, that the piece about saying, thank you very much, patriarchy, but it's a different era. And now my body's for me. And unwinding those stories consciously, like pulling out where they live in you, is a really major step in owning your life. It's not just about enjoying your sexuality. So I encourage people to really take some time and journal about that. Like, what do I believe about my own pleasure? Who owns my body? Is my yes valid? Is my no valid? Do I get to decide? So yeah, tons of questions like that that can help over time unweave those stories.
Yeah, and I think getting to know your sexual self just helps improve your sex life with a partner. So, and feeling comfortable in your skin or being able to communicate what your needs are, I think starts with the woman herself, really knowing her own body and feeling comfortable with her own sexuality. So yeah, kudos.
Another thing from Ishwish was Dr. Justin Lehmiller's talk. Do you remember?
I did. It was fantastic.
Mm-hmm.
Yeah, about sexual fantasies.
Sexual fantasies. And all I want to tell anybody who's watching is whatever your fantasy is, you're totally normal.
Exactly.
He laid out what people wanted. It almost made your raciest fantasy look boring because everybody else has the same one. There's nothing to be ashamed of.
That was such a fantastic talk. And, he has a podcast, and I listen to his podcast often because, I feel like I come to sexual health from the medicine side, and he's a social psychologist, I believe. Hopefully I didn't get that wrong, but he brings such a different and unique element to discussions around sexuality that I really enjoy his podcasts.
Well, this is an interesting comment in terms of the medical side in general, like, because there are women like you who are forward thinking and, physicians trained in traditional medicine, but many physicians don't even have the conversation with their patients about their sexuality. Absolutely. And so you see this whole like parallel universe, paramedical arising to help people like sexuality coaches, sex therapists, pelvic floor specialists, this whole set of professions that are finally aiming at even doulas. Do you remember when doulas were not a thing? Like in the 90s, they were not a thing. When I was having my kids, 80s and 90s, they were not a thing. And maybe just emerging with the home birth crowd. And now everyone seems to have someone like that in assisting them and preparing on the psycho-emotional side for becoming a mother again. And so I feel like as you do your work, it'll become more mainstream to have like a team of people who address the full mind body piece of your sex.
Yeah, and I think there's a variety of reasons why that is, why physicians don't address it. And I think it's part of our broken healthcare system. They don't have time. And so I think that's a shame. That's why I do what I do. In my concierge practice, I allow myself time with my patients because it's such an important thing that it can't be addressed in 5 minutes. So I think that's one stumbling block for physicians to address sexual issues. They don't have time. Traditional medicine, it's like assembly line seeing patients. So I think that's one thing. And the second thing is it's really not taught in most medical schools and in residency programs. So as a physician, if you have no training in sexual health, you're not going to ask about it because you're not going to have an answer. Right. And part of that is within the residency program in medical schools, but part of that is that the medical schools train students to be able to pass the boards, and it's not focused on the boards. So we really need to back up and get it to the boards. And I will say over the last 10 years, I think it's slowly creeping into what the American Board of OBGYN thinks is important, because we do a maintenance of certification we have to do every year. And there are articles that we have to read that are selected by the board. And over time, I've noticed there are more and more articles about, sexual health, sexual issues, common sexual problems. So hopefully we're making, small baby steps to bring it to medical education because it's so important.
That's really wonderful to know that that's happening. The other piece of it is women who, for example, had cancer treatments. We hear this a lot, that they were not informed that their sex life was going to change after it was over.
Absolutely.
And so another good, if you're a woman, Robin Farman wrote a book called The Patient as CEO after her long struggle with a chronic illness, and how you really have to be at the core of your own care team. Like you have to take ownership over what's going on with you and ask so many questions, and then, try to get the cross communication between all of your providers. And ever since I heard her really talk about that, I realized how often I, as a patient, would give my power over, oh, please, doctor, please tell me what to do with my own beautiful body. I don't know. And that's got to stop too. So it's mutuality. I want to go back to something you said about things changing. We just finished a survey of our customers and asked them questions about, how easy was it to talk about their sexuality with their doctor, with their partner, with their daughter or their children, with their own mother, and with their friends, and to rate it on a scale of 1 to 5. And then we divided the answers by Boomer 1, Boomer 2, Millennial, Gen X, et cetera. And across the board, guess which one was hardest? Not the doctors, but guess which one was the hardest?
I don't know.
Mother. It was the hardest person to talk to was your own mother. And so you start, oh my God. And I will say that was true across all generations, but that it was getting significantly better with each generation, like a half a point on average better. So that if you're 20 now, you can talk to your mother. But if you're, but this question of like, if you can't talk to your mother, the entrainment in the female story is coming down that line one way or the other. And so one of the number one things you can do to shift the stories is to start talking. Say it even if it's embarrassing. Say it even if your mother goes, ooh. Say it if you're nervous or you don't want to know the things she does in bed. Like, just talk to her about it and and then talk to your own children. And let that chain of communication across the generations about what it's like menopause should not come as a surprise. Right. It should be like, oh yeah, my mom told me all about it. This is what I expected. Totally normal. I knew exactly what I was getting into. Yep. The secrecy surrounding it is part of the sickness. So
Right. That's one of my pet peeves is that, when you talk about women's reproductive health, it's all about how not to get pregnant and not get a sexually transmitted disease. And I see so many women who come in around the time of menopause and what they think is menopause is hot flashes and night sweats. But menopause is so much more than that. It's low libido. It can be vaginal dryness, painful sex. It can be depression, anxiety, joint pains, weight gain. And I just feel like we've done a very poor job at talking about it, like you said, and educating women about it. So, that's another one of my goals. We keep hitting on my goals is to make sure that women know what to expect and that they don't have to suffer in silence if they're having symptoms, any of those.
And it's co-located with social changes. Like this is when your kids are leaving home. And if you've had such an identity around, like my friend Kathy Joy just did a ritual for us. She wrote a ritual. It's going to be in the next book around the ritual of the empty nest. Mm-hmm. She was grieving so much that her gorgeous daughters, she had a career, she was busy, that they were leaving home, and she had spent so much of her life invested in raising these girls. And there were a million things like the calls in the middle of the night, the visits to the emergency room, the grades, the thing. Like you have basically done an entire career which has no external acknowledgement, and there's no way to communicate it. And so she said, what I just really want is for someone to issue me a certificate that says, good job. And so I said, well, we can do that. We're walking on this trail. I said, we can issue you a certificate. And then she created a whole ritual that she's sharing with it about how to mark the end of that phase and begin preparing for the free period that now. So is the depression coming from, it's not just biological. It's like this whole part of my identity is now dissolved. And if you've been a person who chose children and now this, but it's, the other part of the identity is like, my booty and my tiny little waist and all the other things that I got value for are like, my heads are not turning when I'm walking down the street at 55 for me. I mean, I'm sure some of all y'all are like totally hot and that's happening. But I really felt like in the beginning of that shift, like the move to being matronly was a difficult one to absorb. And I had to really step into my spiritual center and my power as a woman and understand what I was doing with the next half of my life. And so that piece that I really encourage you to join, like if you're in perimenopause, Hey Perry's got a great community. There's some art, we have a little community online that is about talking about these things and normalizing it, and get with other women. Like, what are you about? in the second
Absolutely.
half of your life, when you're free of so many of the earlier obligations and
Right.
even free of some of the hormonal fluctuations that tied you to the planet. Like you have so much opportunity now to create your next play, I guess.
Yeah, absolutely. I mean, I think you nailed it. And I try so much to let women know, like anxiety, depression, like you mentioned, you grieve that, your identity was you were a mother and you were raising kids and now your kids are leaving. The other thing that women who are, early 50s, late 40s, who are going through these changes face is aging parents.
Yeah.
So, you look at all these stressors that happen around that time. It's easy to be depressed or anxious, and absolutely the identity with your beauty, that definitely plays a role. And like you said, heads aren't turning, or you do have to readjust. And I do love the community idea. We have at Evora, we have a Facebook community. It's not secret, but it's a private group,
Private. Yeah.
where women can talk to each other and help each other, support each other through these changes. There's so much value in support groups, just in like normalizing what you're going through. So I love the support group idea.
Yeah, the community piece. There was
Mhm.
something else I think I lost the thread for a second. So you pick up because there was something you said that I want to follow up on.
So we talked about depression, anxiety, aging parents.
Oh. And then the other thing, if you're in a heterosexual relationship, have you ever looked at those like 5 love languages thing?
Yes, I
And
love that. I recommend that book all the time.
it's so good. The problem with it is that almost all men say their primary love language is sex and touch because they don't have any contact with the rest of their emotional life.
Right.
Sorry, this is not for you conscious men out there who like who know their emotions and what drives them. But when your libido drops and your partner's like, that's the only way they feel loved, that is a really hard time in a marriage. And that's also happening when your collective identity as a couple is being, like, as a family unit, is being challenged. And so, this piece of how to stay connected to the person you love and make sure that you're both feeling loved in that window is what like helps people survive so many. The inflection points, I think, for separation are when the kids go to junior high school is a big one, and when they graduate from high school and they leave home, that the sort of what kept you together is dissolving. And so this is a time to reinvest in the relationship too.
Yeah, I see that so much in my practice. I would say about 40% of my practice is low libido. And, and that loss of, when you talk about, love languages, and men need touch, and women in general, this isn't true for everybody, but women may need something else. Something else might be their love language, whether it's they like to receive gifts or words of affirmation, and men need that touch. It really can throw a wrench in a relationship when there's a desire discrepancy. Because what I've heard is, just from my patients, is that, men want that sexual portion of their life. Women, especially as their testosterone goes down, their hormones change, a lot of changes around that time, they may not have that drive. And then the man might keep initiating, the woman says no, and then he feels rejected and stops initiating, and they stop having sex. And, sex is a really important, for many people, not for everybody, but a very important part of a healthy relationship. It brings you together. Like you mentioned, the oxytocin, it's that bonding hormone that happens when you orgasm. So, and women don't know that a lot of that has to do with menopause as their sex drive drops. They know all about the hot flashes, but they didn't know that their testosterone starts going down in their early 30s. So it is important to talk about, and and if it's really becoming an issue, to see a sexual medicine provider to help with that. And it's not all just throwing medicine at people. That's not the right answer. I'm a certified sexual counselor as well. It has a lot to do with relationship and communication, maybe other medicines you're on. It's contextual. It's a super complex thing, but so important.
So I'm going to tell like my little personal story. So I've been dating this guy for 9 years. Like I was married I met my husband at 16. I was with him till 37 and we had 4 children. And then I was with someone else for a decade and I raised his 2 daughters. And then I decided I was just going to like find myself. So it coincided with, menopause and perimenopause and all that stuff. And I have a really beautiful older boyfriend. I mean, my age, a little older.
Yeah.
And he went in for his menopause or his hormone test, and it said he had the hormones of an 80-year-old man, which is why we were like matched perfectly. It was great. I was like, this is awesome. Lots of touch.
Women who want that in your partner.
So he went and got testosterone.
Yeah.
And oh my God, like his muscle tone came back, his desire came back, his like brain went back online. And like, he's like a 35-year-old now. And in order to keep up, I had to like go get my own hormones tested.
Yes.
And then like get the little dumb pellet I got the pellet in my butt that does a time release hormone. And we are like kids now, which is really also unexpected. I was like ready to ride off into the sunset, but I'm glad I did it. Anyway, yeah. So
I see that a lot. That happens a lot. Women come in and say, my husband got testosterone and I need to do something about this because he always wants to have sex. There's so much you can do. And one thing that I think is really important that I just want to throw in there is that, we talk a lot about moisture in the vagina, but hormones, giving the vagina back its estrogen goes such a long way in restoring sexual function. It helps improve blood flow. It helps the vagina regrow the cells that make moisture. You still will likely need a lube or a moisturizer or both. Yeah. But estrogen, local vaginal estrogen, goes a long way, and it does not increase your risk for blood clot, heart attack, stroke, or breast cancer. So, so I was talking to a patient the other day. We were talking about, conditions and medical conditions, and she didn't want to be on a lot of medicines, but in her mind, hormones were not a true medicine. They were just giving you back what you're missing. And I'm like, you lost it. Why do we have to give up those hormones that did so much good for your body? We can replace them in a safe and effective way.
So in general, I feel like you can do so much with, you can go really a long way with diet. You can go really a long way with exercise, with supplements. We do herbal drops that include some overall vascularization things that help with arousal. And then you can do topicals. And then when it comes down to it, there's all kinds of other medical interventions. But I would not leave out, I mean, I know I'm a mind-body person. That's like my core way of understanding the human experience is the whether it's therapy or adult education of like how to be an embodied lover, like that stuff. I started learning about Tantra and sexuality not until my 30s. And I was shocked at all the things I didn't know about my own anatomy. So the stuff that's about like, take some time, be interested in it, learn some new techniques, learn your own pleasure, then it come for the medicine. If that's not working, that's my bias anyway. So if I had a wish, every woman would reclaim her body as her sort of natural and complete and perfect and true expression of whatever you believe as divinity or energy on earth, that you would love it from head to toe. You would tell it every day how great it is. Like, thank you, feet, for helping me walk across the planet. Thank you, hands, for doing all the good work in the world. And that in doing this, like, reclaim the natural joy of living, and from that self-love, seek solutions, not from I guess what I'm trying to say is seek it as a form of natural expression, not from trying to fix anything. Like, you're not broken.
Right.
Everyone would know you're not broken. You're perfect, whole, and complete. And this is just another way of caring for yourself and expanding the experience of your life in a body. So that was the impetus behind doing the whole line, and why I spend my days waking up and talking to women about, wiggling their hips and all the other things they're doing.
Right. Well, is there anything else you wanted to add that we didn't have a chance to talk about?
I don't want to add it, but I want to emphasize again, if you are carrying stories or narratives of sexual shame, of purity culture from an evangelical environment, of sexual trauma from being abused, 1 in 3 women have had sexual trauma. If you're carrying that stuff, please take the time to get it out of your body as much as you can, to gently and compassionately unwind those stories so that you can live freely and inhabit exactly what you're here to do. That would be my number 1 plea. And if you want to try product, you can get them from us, or you can get them from Dr. Becky. And let us know. Let us know how you like them. It's an honor to make them. I have a full body oil that came out last year that is designed specifically for scars and stretch marks. It has a beautiful Schisandra chinensis, which is an adaptogen, and pennywort, beautiful herbs. And we're coming out with a line of euphorics for relaxation in the fall, which
Fantastic.
euphoric is just a thing that opens up your heart. It's like all the good stuff of THC and CBD without the psychological or the psychoactives, and also completely legal in all states. So we'll add those soon.
Well, thank you so much for joining me today. This has been fantastic. I really appreciate you giving us your time, and hopefully we'll get to chat again soon.
I loved it. Thank you. And thanks for what you're doing with Laura. Okay.
Yeah.
Bye, everybody.
Right. Bye-bye.
Thank you for listening to today's podcast of Intimacy Unmuted with special guest Christine Mason, founder and CEO of Rosebud Woman. Don't forget to like, comment, and subscribe if you enjoyed today's episode. Follow Evora Women's Health and Rosebud Woman on social media, linked in the description below. Visit evorawomen.com or rosewoman.com to purchase your Rosebud Woman products today. Until next time, unmute your intimacy and stay sexy.